Good evening, everyone. Happy New Year. How's everyone doing? I was told that there's a demarcation line on when you can continue to tell people Happy New Year. I don't know what that is. I've just decided to make it January 21st. I would like to wish all of you Happy New Year. I do want to thank all of you for flexing and making the time to be here this evening. I know that we said that we were going to meet and start on a consistent basis in February, but the Omicron variant had other ideas, and it's really important for us to have something to take to the Board of Education at our January 24th meeting, which is this coming Monday, to recommend to the board. There's just a lot has happened since we've returned from winter break. There was a request for data that we discussed at our last meeting that Jamie Price has worked on. I would like us to start by looking at that data, and then I would like to maybe just give a narrative on what the first 2 to 3 weeks have been like for our schools since we've arrived back from winter break, and then have a discussion around what your counsel is for us, but to also look at some potential recommendations moving forward. I have some ideas that I would like to float to the committee for your consideration, but also would like to hear ideas from you. I see that there's a hand raised from a participant, and I know in the past we have not, in a virtual environment, we have not allowed participants to, I think, ask questions, but I guess if we could at least put the questions in the chat.
Dr. Means, the chat's actually closed to attendees.
Okay.
Did you want me to open that up?
Yes, I think I don't mind if there's a question. I'll take a question. I would just ask that the questions are directed to me. That would be helpful.
Okay, that's the chat's open and the messages will come through to the host and panelists.
There was a hand raised.
Oh, I'm sorry. You want me to open that up for questions or for comment then?
I saw a hand raised.
Yeah. Okay. Sorry, I misinterpreted. I thought you just wanted the chat open, the messaging chat. Joe McCluth, you have the microphone. You will need to unmute though, Joe McCluth. Joe McCluth, you have the microphone if you would like to unmute. He just dropped his hand, so.
Okay, that's fine. That's great. So why don't we start with the data sharing? And Tim, you asked a really good question of us trying to mirror our experience from one year to the next, so we can try to predict what we're seeing with cases. And I think Jamie did a really nice job in taking that request and trying to figure out where we are with our cases. So Jamie, I'm going to turn it over to you, and if you could share your screen and just walk through some of the data that you've been able to collect for us.
Absolutely.
Thank you.
So good evening. What I'm going to do first off is just take us through our traditional dashboard here. Does everybody have the dashboard on the screen? Yeah.
Yes, I can see it.
Yes.
Okay.
Good, Jeannie.
So obviously, I mean, we've seen a spike in the last couple of weeks, currently at 138 in isolation, just under 500 in quarantine, sitting at about 1.3% for students and 1.6% for staff members over the past 7 days. We exceeded the 1,000 mark for student cases just recently, as well as staff cases. And we have the likely source of infections and stuff down there, but I'm sure you have all seen. Now, this is updated as of yesterday. So for actual positive cases, we certainly saw an increase up around the last week. You can see here, it got quite high up around the start of January, around the start of school, the 8th. So that's sort of like the lead out from winter break into the start of the school year, but it is decreasing. As far as exclusions go, it got pretty rough there for a couple of schools, especially around this mark. Madison in particular got up to 43% or 44%, but they're all decreasing now as well. Did anybody want to explore these stats before I move on to the next thing?
Jamie, this is Anne. Just a quick question about the headline or the heading of that table, COVID illness. So those are students who have been vaccinated, or what is?
No, I'm not. I'm actually not really sure. I noticed that today. I didn't set this dashboard up, so I'm not sure what that statement is referring to.
Okay, it's not referring to your table.
Data that's going in here does not take into consideration vaccination status or anything like that at all. It's just pure statistics.
Thank you.
I think at one point it was to reflect in the post-vaccine eligibility era, I think is probably what it meant. Post.
After vaccinations became available or something like that. Yeah. Okay. Any other questions about this dashboard before I take us on to the next thing? Okay. As Mr. Doman says in board meetings, hearing none, we will move forward. So I have a couple of caveats here with the thing we're going to do next. Tim Richer, you asked for a comparison chart of last year's infection rates compared to this year's infection rates. I've put that together. However, I did not interrupt this dashboard here that you see on the screen right now. I didn't want to take the chance of jacking it up at all. And then also, in order to do a proper comparison, we had to align windows or times. So they both start on September 8th and they both end on a certain date in order to align both graphs. Now, the numbers we're about to see are going to differ from what we see on this dashboard. And part of that is because there are cutoff dates. This dashboard includes the calendar year. The dashboard I'm about to show you includes only a certain amount of time. And the other thing is, this dashboard is not public. And the reason for that is we are looking into data visualization as a district. And this is one of the tools that we are potentially going to use. Therefore, this is a trial version. This is not, we don't own the licensing for this to publicly post it, et cetera, et cetera. So it's not production ready, live website ready, but this is where we are. We started on September 8th. I took the data from September 8th all through to the end of the school year of last year, which was Friday, June the 11th. Now, obviously from this date, 15th was the last time I put data in there. And that's another thing too. This data is not dynamic. This was, like I said, this was an experimental build. So it's not constantly pulling from our SIS or our health records at all. It was just put in there on a one-time basis. So the last time the data was updated was Friday, January 15th. So you can see that over the course of time, based on that data set, last year there were 396 cases. This year there were 1,300. If I zoom in on that, we can see at the start of the year, there was a bit of an increase as school started, but in this period, October, November timeframe, the counts are pretty much the same. The light blue line is 2020 or 2020, 2021 last year. The dark blue line is this year. So you can see they're flip-flopping, but relatively close to each other until we got to this point, which is Thanksgiving. And this was also around the start of the Omicron, or at least broad public knowledge of Omicron coming into the wild. So here we are around Thanksgiving, and we can start to see some significant increases. You know, on this day, it was a count of 2. The following year, it was 13. And then around here, coincidentally, as Caitlin reminded me or told me, Thursday, December 10th, or the December 10th was around the time of the East High School football game. And at that point, straight after that, we saw a rapid increase, or a very large increase. And that increase then just led into further into winter break, which was, Christmas and New Year's. And here we see same trend, the same pattern, just a significantly larger amount of cases than that of the previous year. And in fact, if I pick winter break, we can narrow down there a bit closer, and we can see the disparity. Here, there was a count of 9 cases on this day, but 32. At its peak, we had 1 on January 3rd. Well, actually, January 4th would have been the first day of school. But on our first day of school this year, we had 73 cases. And we can see over this small sample here, the comparison was 54 cases to 609 cases for this year, just in this short amount of time, this 2-week window. But even though the cases are, or the amount of cases are higher, we can certainly see that, as I stretch that back out, the pattern is still being followed, right? So if we follow that past our last input date, we can see that for the next 2 weeks, up until this day, February 4th, we're pretty much, assuming the pattern stays the same, we'll probably see the same amount of cases that we are currently seeing. And I know today we had 30 cases that came in. The day prior was 1. But then once we hit February, it pretty much peters off to nothing. Okay, and that stays at that rate until we hit here. And here we have a bit of a surge, which coincidentally is the end of spring break. Okay, and then it peters out again. So with that being said, that is your comparative data for 2 years. Does anybody have any questions on this before I move on to the next screen? Okay, none. The next visualization that we have here is those 1,300 cases and the rates of vaccinated and non-vaccinated, as well as likely sources, and broken down by school level. I do have another caveat here. As I collected this data, there were some records, excuse me, not recent ones, but more sort of like towards the start of the school year, where we didn't have vaccination information. So I took poetic license with that and basically said that if we don't have that record, we're going to assume that you're not vaccinated. However, the number of records that were in that category were few. But this does match the number of cases that we see on this page. So overall, 1,300, it was broken out 592 in the elementary schools, 428 in the high schools, middle schools, 270 cases, and then other was, outlying areas, or ones that were actually marked as other. Between those, we can see that probably about 60% likely sources were unknown. I would say, what's that? Probably 25% were from the household, 10 to 15%, 10 to 15% from schoolwork, probably about 7 or 8%. Actually, about 8% for school/work, and more like I would say 6 or 7% were from social. And then these other ones are sports and activity, but they're quite negligible. Out of all that data, the amount of vaccinations, if I click them, we can see that total out of 1,300, 577 cases were vaccinated, keeping in mind this was for the entire school year. And this is only 21-22 data as well. And the number of vaccinations, different levels, 286 at the high schools, a much lower vaccination rate or percentage at the elementary schools, but obviously that comes with just availability at that age level, and probably about 40%, I would say, 45% at the middle schools. What's more interesting, though, is if we look on the likely sources, and the likely sources are what the nursing staff gather when they record positive cases. We can see that, the highlighted ones are the actual vaccinated rates, 40%, 50% for unknown, 88 out of 235. So that's just a little over 30%, 50% again for social. But if we look at school and work, we can see that it's actually down to about 25% there. I can also zone in a little bit closer on that if we like. And just on that area, school and work, we can see that it was actually quite only a handful of cases really at the elementary schools that were vaccinated and reported as positive cases. Again, only a handful at the other school levels as well. I can switch back against who wasn't vaccinated. Again, 50% in unknown and social, probably about 65% in household. If we look at school and work, 75% of school infections were not vaccinated. And if I zoom in closer on that, we can see obviously the large majority of that small portion of students that were infected or reported positive at school and work, the majority of them were not vaccinated. I can zoom in on that as well, just so that you see how that compares to all the others. And that is all I have. Does anybody have any questions about this or would like to look at it from different angles?
Jamie, I have a question that I'm hoping between you and Laura, you can answer. Can you remind us again? I think there's some interesting data here in case counts versus for vaccinated students versus unvaccinated students. I'd like to know where we're at right now for our best information of percentage of students vaccinated. And then elementary, maybe too early to tell, but 12 and up. Do we have that? Is that?
Oh, we do have that information. It's not included in this visual. I mean, the percentage would be 592 elementary school students against however many we have. So I would have to. Well, actually, these are only positive cases.
I'm
do we know how many are vaccinated? I don't know. That would be something Caitlin could answer.
Can I just say that there's a problem with this data because we keep our own data here at TOSA Peds as to whether or not they're vaccinated for every single person that comes in for a test. And I just looked at the last week, and I'm looking at in the last week of the positives, 1, 2, 3, 4, 1, 2, 3. I mean, it's more like 50-50. So I suspect that we must have inaccurate information as to who's vaccinated or not.
Well,
I mean,
what we're seeing here are reported cases, and whether I select vaccinated or unvaccinated, on the most part, it reflects that 50-50, right? For the two largest areas, or for the unknowns and socials. So I think this represents 50-50. What I was talking about, the 75-25, is purely for those that reported school or work, and work being the district
source
staff members as the source. Yeah.
All right. Yeah, that makes more sense.
I can speak to Wauwatosa residents specifically. I know that doesn't align exactly with the students in the district, but I would say overall our community positivity rate is about 76%, and those younger kids are in that range as well. I think we do need to have a little bit different conversation now that boosters are available and we're seeing cases come through with people who aren't fully or not up to date on their vaccines. So there's a different conversation now between people who have just received their primary series and are up to date with the boosters.
I think I do need to mention too that this data is only positive cases. This isn't a report on vaccination rates. This is a report on vaccination rates for positive cases that have been reported to us. Any other questions? Caitlin, did you want to mention anything about the vaccination status reporting for all students?
We have been able to sync Infinite Campus with the WER, so it's a manual thing. It doesn't go automatic. So periodically, one of our IT people clicks a couple buttons, and then a day later we get the new upload of vaccination information. So we do have fairly accurate information right now, but we do still have a number.
Actually, I do need to mention something about that. It's not a simpler process as that. It's a massive amount of work. When we synchronize with WIR, we cannot be selective about the vaccination information that we sync. It's all vaccination information, and it creates thousands and thousands of errors because they don't, standardize their data the way we do. So it's not just a click of a button and an import of information to say that we're up to date. We do those syncs, recognize that there's thousands of records, and then apply our best efforts to try and get those corrected as time allows with other burden as well.
Yeah, so we do still have parents, we're still asking them to send in their vaccination records when they have them, because we know that we still have errors, but yeah, things are looking pretty good for the number of kids that got vaccinated. I don't have exact numbers right now.
Are we,
for Jamie?
I'm sorry. Yep. Are we done? Should I stop sharing?
Jamie, I think you did a very nice job sharing the data. We really appreciate it.
Okay, back to you. Thank you.
Thank you.
Can I ask Laura a question about the vaccination rate for the younger group, what we're seeing in our community? I mean, anecdotally, at the hospital, I feel like we're the 5 to 11 group, there's a lot more hesitancy. Don't know if we're seeing that in our local community as well.
Yeah, I would say that age group is still sort of behind the overall vaccinations rates we're seeing in the community. I think when we first looked at the numbers, we saw about 50% get vaccinated in the first 5 weeks or so. And then similar to the older age groups for the 12 to 15-year-olds, we'll probably see that get up to that same 75, 80% within 5 months. So I think we'd probably see that happening around March or April if it follows the same trend.
So that kind of leads us to, I think it may be helpful before we get into what I would like to pose as maybe a discussion of things that are in my head that I would like to get advice from you on. I just want to kind of describe the first few weeks of the returning from winter break for us as educators to the panel and to the advisory committee. It has been beyond difficult. It's to say that Caitlin and her team were overwhelmed with the number of calls that came in regarding COVID positive cases that occurred over winter break, and that were occurring right after winter break. The infrastructure, if you can imagine our nursing team being an infrastructure, it broke. It severed. It was broken, and it got to a point where our administrators were assisting and trying to assist with contact tracing, and so if you can imagine, we had administrators and we had administrative assistants attempting to help with contact tracing. We had parents, and we still have parents in some cases, receiving information around the fact that their child had been a close contact days, or in some cases a week later, because of the break in our infrastructure. We had a number of our families extremely frustrated with the break in our infrastructure. I think one thing that really backfired in our protocol was the differentiation that was made with the quarantining of vaccinated versus unvaccinated students. A lot of our families who have children who are unvaccinated felt that they were being segregated, and in some cases, our office staff were not as discreet as they should have been in figuring that information out. So those students were their status was really made public. It made for a very difficult time. And that was on top of our team trying to find teachers to fill vacancies, and young people worrying about if they would be able to Zoom in for classes, and if they could be available in person for final exams. It just made for what I would say, after 25 years in administration, some of the most anxious time that I've ever been around in education. I'm so thankful to our staff for making things work, for allowing us. You saw those spikes that Jamie that he showed you in terms of the cases, and that was not only with students, it was with staff as well. And we had so many of our staff fill in for their colleagues, but it was a tough time. And I'm glad that the last few days have been somewhat calm, in COVID terms, at least. They've been calm. They're still not what they should be for a regular school environment, but they've. I would be a poor advocate for the staff if I'm not telling the story of how difficult that all of our staff and Caitlin deserves so much credit, and her team deserves so much credit. And a lot of our administrative assistants deserve credit, because once we realized that the calls were just overwhelming, it was a tsunami of calls coming in to our nursing line, I put out a distress call to all of our administrative assistants to see if they could help the nurses in picking up calls, and they stepped in and they're assisting. But I want to express to you the stress that the organization has been under, but more importantly, and I want to stress this because the adults will figure it out. More importantly, the stress, because we talk about mental health, the stress that our families and our students have been under in regards to just navigating this new variant and how we're handling it as a school system. So I want to pause here. I want to open it up for Caitlin. Caitlin, if I missed anything in terms of how the infrastructure has been stressed the last few weeks, please weigh in.
I think you summed it up nicely. Yeah, definitely making the change from doing interviews of students to find their close contacts to just going off of who was in the classroom increased for sure, which we expected it to increase. I don't know if proportionately it was. I have not had a chance to look at any numbers other than that it's a lot more kids, but we've also had a lot more cases. Back when we decided to make that change, my crystal ball wasn't really working, so couldn't have predicted that this was going to happen quite as it did. But it's been hard. It's been hard for everybody involved, and I talk to parents all the time, and it's hard on everybody.
And I want to say their frustrations are legitimate. And so I want to open this up because you're the medical experts, right? So I have questions, and I have questions that they have posed to me and that they have posed to the board that I don't have answers for. I need your counsel. The questions that are coming to us are, so if we're learning that cloth masks are not as effective as N95 masks, then what's the future of masking? So that's one question that's been placed out there for us. A second question that has been placed out there for us is that how effective is contact tracing? And a lot of our families are pointing to our neighboring districts in Waukesha County, and they're pointing to them, and they're looking, and we understand that it's comparing apples to oranges in their statistics. It's hard to compare their data, but we have a lot of families who have friends and relatives and family members in those districts, and they're comparing their experience, and they're saying their kids are not having as much of an interruption in their educational experience as much as our kids are. Help us understand how your protocols are keeping our kids safe, maybe medically, but how are you keeping them safe from an emotional and mental standpoint? So I want to pause there and ask those two questions around masking, and then also the contact tracing component of things.
I can start with your first question around masking. Right now, we recommend well-fitting, high-quality masks. And so I kind of view masks as a spectrum. So no mask is sort of the worst choice. Then you have cloth masks with a single layer, which are better than nothing, but maybe not great. And then you have cloth masks with multiple layers or filters in them, which are pretty good. Then you have disposable, like surgical or medical masks, and then N95s, which are better. So I don't think you want to say there's one or the other you should be using. I think there's maybe a spectrum to that. And we know that there's not always N95s available for everyone. That doesn't mean you should go without entirely. And that's more specific to Omicron than it is to past variants, which could always change again in the future.
Thank you.
Just to follow up on Laura for a minute, I mean, I think you have to weigh what's practical as well as what's effective. So looking at that spectrum and recognizing that there's varying levels of effectiveness with the masks, but it's not practical to offer N95s for all students. That's just expensive and just not feasible. So again, as Laura said, no mask is the other side of that spectrum. And I think that's got to be a place where when masks are required, that there's latitude for parents and families to choose the mask that's going to work for them.
Thank you. Maybe we can pivot to the contact tracing piece. And I think we talked about this at our last meeting. Contact tracing has been very difficult for us. ranging from when we do contact tracing, even when it's in a normal environment, the behavior has pivoted to it is placing kids in a tough space where they don't want to talk about the environment, and it feels like they're putting they're telling on their colleagues and their classmates. There's a lot of school systems who don't contact trace, and they simply, if we're all a classroom, for example, those of us who are in this panelist room, if we're all in a classroom and I am a COVID-19 positive case, what happens is that I'm identified, and then a letter goes out to the rest of the classroom that says, there was someone COVID positive in your classroom today. Watch the symptoms, but everyone can come to school tomorrow. And that a lot of families have emailed me to say, Dr. Means, why can't we use that model? That's a model that accomplishes the goal that you claim and that the board claims you want, which is we want to keep as many kids as possible in school. It does a few things. One, it eliminates putting our administration and first of all, it keeps our administration out of being medical contact tracers. It then keeps our nurses out of being investigators and putting our students in positions where they feel like they're tattling on their classmates. And ultimately, it keeps students in school and allowing families to make the choice of self-quarantining if they feel the necessity to do so. My question to this powerful medical panel is, do you see challenges with that protocol?
Laura, do you want to start with that one again?
Yeah, I think there's obviously a lot of arguments in this area, and I understand contact tracing is a huge challenge. I mean, we're seeing that at the health department, just like you guys are in the school district. We are starting to see the decrease in cases, and hopefully that will drop off pretty quickly, like the data showed us in the trends from last year, which will decrease the burden. I'm thinking through a couple different things. We removed the sort of burden on kids themselves to, sort of rat out their friends through this classroom letter. So we removed that barrier already. People who choose to get vaccinated aren't required to quarantine, so they are able to make a choice to stay in the classroom by getting vaccinated. We're seeing still cases are higher than they were at any point last year. It's still very high compared to even November of last year. This isn't over yet. Contact tracing still does serve a purpose, and we want to, protect our kids as much as we can.
May I push back?
Yes.
So the emails I receive from families who have children who are unvaccinated would say, you're not protecting my child. I've made a choice not to vaccinate my child. That's our family's choice to do so. And in fact, what you're doing is you're taking education away from my child. You're not protecting them. In fact, you're imposing your values on my child. In fact, you're doing the opposite of what you claim as a school system you want to do, which is protect their social, emotional, and mental health and keeping them in school. And so I don't know. That's the pushback that we receive. It's a compelling argument that I don't have a good answer or response to as an educator.
Sure, and others can feel free to jump in. I would say that looks at sort of a very individual level of disease and COVID. When we're looking at it as a public health concern, vaccination protects you, but it also protects those around you, and quarantine also protects those around you by preventing the transmission of disease in the classroom. So, even if one person decides that that isn't fair to them, we're looking at bigger than individuals. We're looking at classroom-wide, we're looking at school-wide, trying to keep more kids in the classroom through these mitigation pieces versus one person who chooses not to get vaccinated.
Okay. Thank you.
I think Laura said it really well. I don't have anything else to add from the public health perspective.
I would just add to kind of piggyback off of Laura's comment. I mean, the question that you're getting at is this whole individual versus group well-being. And that's something that, you know, we're never going to agree on. I think people, you know, that's based on culture, that's based on experiences. So there's no way to make everyone happy in terms of that, like, you know, individual versus group. So I think we don't have a good answer because it kind of depends on the district's values and what they're going to prioritize. And when we prioritize one thing, we lose some of other things. So if we prioritize, you know, trying to keep the majority of kids in school, you know, some that choose not to be vaccinated are going to kind of be hit. And that's just kind of something that the district needs to determine. Does that make sense?
Yes. Yes.
And it's hard. I mean, there's no easy answer to that.
And I would also add, you know, we're all over the pandemic. It has gone on for so long. It's even been worse over the past few months. Me more than anyone else wants it to be over so I can get back to my normal work. But just because we want it to be over or it's hard or we're tired, removing mitigation isn't going to end the pandemic. We're going to still see kids who are out of school with, you know, COVID positive cases. We're going to still see kids affected through transmission. Those pieces are important to keep as many kids as possible in school until we see the end of the pandemic in a real way.
I would
All right.
just offer one other thought on the contact tracing. Again, back to kind of the individual versus the group. Contact tracing is notification of a positive case so that those families can understand the risks to their other family members who may be at risk of getting a severe infection from COVID. So there's a cascade of community members that may not be in our school district, but do need to know the risks for them based on the status of their child. So a family may make a decision to do a rapid test if they're aware that the child has been exposed in a school setting, or make other decisions about interactions with those more vulnerable community members. So just recognizing that contact tracing has a purpose back to the public health perspective of the whole community, and that is also the value.
Quick question. Do we think that given the high community prevalence that contact tracing continues to be as effective, meaning that you could have multiple exposures throughout the day? And have we seen any data that we're losing the value of contact tracing? And honestly, not trying to ask this to be controversial, just wondering if anyone's seen anything in regard to that information.
I think that what we're losing is the actual contact tracing. So we're having exposures in so many different places that the root of the system for contact tracing has been kind of gutted right now. And as cases are slowing down and there's more ability to do it at that individual level, then we will be better able to contact trace. I think right now we're making assumptions that no matter where we are in a public setting, we're likely exposed.
I would add to that, with the increased demand in testing and the increase in cases, and I'm sure you saw this in the school district as well, there was a lag in results, which just sort of exacerbated the problem with contact tracing, because by the time someone got tested and got the results and the results came through and were reported, it was well into someone's infectious period and into their isolation and quarantine. So it did make it really challenging to follow up. And like Ann said, as those cases go down, it makes it a little bit easier.
I don't mind being controversial. You know, at our last meeting, we talked about goals and values, and several were thrown out. The two I remember most vividly are one, keeping kids in school, and two, finding that balance between keeping them in school with as normal as possible and living life as normal as possible, balance with not creating a greater public health problem. So, and to Sean, to Dr. Nolan's point, his big fear of this plan was that it was actually going to make things worse. And I think he was right. So I guess in my opinion, Dr. Means, the plan as it stands now is a fail when it comes to keeping kids in school. I mean, the numbers of people out are terrible. And when you look at Jamie's data as to where kids are contracting the virus, it's, while a big chunk are unknown, when you look at home and other sources, the number of people contracting this illness in school is super, super low. Now, that might be because contact tracing is doing some good and because that's where it's the only place where they actually can wear masks. But I would say that, you know, the contact tracing as it stands now with this particular variant, and I guess I should digress to say, you know, I think our response is going to have to be variant specific. And, you know, 2 months ago, we didn't know everything. We won't ever know everything. And I think one of my, to digress further, sort of problems with the district's response over these last 2 years is just too slow. And it's not responsive enough. And it's not to what we're learning on the go. For me, as a pediatrician, when I'm reading data coming out of South Africa, I mean, I think we would have known in 1 or 2 weeks if this particular variant was killing kids. I mean, that's news that would travel very, very quickly. Every week that or day that goes by where you don't hear reports coming out of their ICUs that we're losing children or that a huge number of them are coming down with inflammatory disease 2 weeks later. Every week that goes by is one more week, you know, showing you that this variant is not going to be a big deal, and it hasn't been. As far as protecting the community, and I want to make it really clear, there's a subset of the population that can't get vaccinated and have conditions that put them at risk. And I think that when we talk about the community, you have to pull that group aside because we need to figure out how perhaps to help that specific group. So what I'm about to say, I want to make it really clear that I'm pulling that group out. We need to figure something out on how to keep them safe. But the rest of the community has decided whether they want to live or die. I mean, they've either vaccinated or they've not. And I don't know, I'm sort of at the end of charging our children with the task of preventing unvaccinated adults from getting sick and ending up in the hospital. I don't think that's our kids' problem anymore. And families who have decided not vaccinate their kids, they've made that choice for themselves. So I think that our contact tracing, our quarantine rules right now with this particular variant, knowing what we know about it, is a fail when it comes to keeping kids in school, number one. And number two, I don't think it has really much, if any, impact on the public. So I would be in favor of, you know, what you proposed, Dr. Means. You're around somebody, you know, I don't even know if that's possible, Caitlin, if even that type of level of contact tracing when you have a number of cases like this is possible. But we need to stop having kids out of school for something that doesn't put them in the hospital. hardly ever.
Could you clarify, are you talking about people who have been close contact, eliminating the quarantine for the students who are unvaccinated, or are you talking about getting rid of isolation as well for people who have COVID? Because I think that that's been unclear.
I think that would be a hard sell for, isolation, getting rid of isolation, but I would at least bring it in line, because I don't think it is yet with CDC.
Right. That was, I believe, probably a later part of this discussion as well. So I just want to be clear of what you're proposing.
I would propose that we're at least doing what the CDC says. And I don't think I would quarantine anybody, vaccinated or not, for exposures. And whether or not the district wants to, how much energy they want to put into telling families when there's a positive, I guess that's a resource decision.
So let's really get into it now. If the data that Jamie provided us is accurate, let's keep in mind what we presented on December 13th of 2021, which is if the infection rates at a certain school is low enough, we would like to provide those schools the ability to have the option to not mask. So there will be optional masking. Is my understanding, but I want to ask this group. It's my understanding that if that's the case, if we have optional masking, that then you have to, according to the CDC, then you are obligated to have a 10-day quarantine duration. So I feel like we're in a tough spot that if we want to maintain that goal of keeping the hope of giving students the option of unmasking if they choose to do so, once infection rates are low, based on the board decision on December 13th, then according to the CDC, we're obligated to have a 10-day quarantine. Please tell me if I'm misunderstanding the CDC guidelines.
That's correct.
I've shared this with the board members as we've talked this through, and board members have kind of said, oh. It's kind of like, oh. And so I share that for our committee and for the public to hear, because ultimately, it's my opinion that we do need to have some type of ability, goal for our community to have to give families the option to not mask, because there, as we know, that's a hot topic button. And some families don't believe in masking and some families do. And to give people the option is important if the infection rate is low enough. But let me ask this question. Does the school district have the authority? Can the school board, can the school district say, we're going to still provide optional masking and we're going to have a 5-day quarantine duration? Can we do that?
I guess it's not necessarily a yes or no answer. There's levels of things that you can choose to do as a school district. The guidance from the CDC around isolation and quarantine did not change what an infectious period is. They narrowed it down to when someone has COVID, they're more likely to transmit the virus 2 days before their symptoms start and 2 to 3 days after the symptoms start. That doesn't mean it's impossible to spread symptoms beyond that time range. It just means that most of the transmission happens within that 5-day period. So that's why masks are so important for that full 10 days. of isolation and quarantine because there's still a likelihood of transmission or a possibility of transmission during that time. So the guidelines are very specific with that information. So you can pick and choose whatever you want, but that doesn't mean it follows the guidelines or the science. Or you can pick and choose some things, not all things.
So in essence, we could keep the optional masking and go with a 5-day quarantine duration.
That's not the guidance.
It's not the guidance. So we're not CDC.
I think you'd have to
Before.
talk to your attorneys about that.
Yeah, I would
Not
say
Laura.
there's specific things under state statute 252 that obligate you to do certain things with communicable disease. That's a very complex and long statute, and there are also things in administrative code, so you'd want to make sure you're looking at those specific things. So when it comes to reporting disease, reporting close contacts, all of that falls underneath there.
And again, and I appreciate and this is my last question, and then I want to open it up for others. But there are some school districts who have chosen not to do certain things legally as well, correct?
Yes.
Okay.
Yeah.
Laura, real quick, wasn't the CDC changed to also specific to Omicron knowledge?
I think it was.
I think it specifically pointed out that that some of the change in the recommendation came from the uniqueness of this particular strain.
Yes.
And that's one of my points. I think as a district, we need to be able to pivot far faster because we could have a strain that does start landing 9-year-olds in the hospital. We need to be able to pivot much faster in both directions.
And I'll chime in here. Dr. Means, whatever comes before the board, I would like to see a component of it provide you the authority to be able to make those pivots quickly without needing to come back to the board. So I don't know if my fellow board colleagues will get there, but I would like to find something that allows you the capacity, such as from over the last couple of weeks, where you could have put things in place to make some of those changes. And you and I have spoken, and I don't think you've been given that authority, and I think that needs to come out of our board meeting on Monday if possible.
There's a policy, and it's I think it's policy 8450, and it talks about communicable diseases, and it defines them, and it's things like scarlet fever and whooping cough and measles. I don't think COVID has been defined as such. And I think I don't know if that's one of the challenges to us utilizing policy 8450, but at the same time, Eric, to your point, I don't know if there's anything preventing the board in including COVID in 8450. Because there have been, one of the complaints from the community, which is a fair complaint, has been the district hasn't been nimble enough. Well, we haven't been nimble because of the way we've been structured in handling COVID. We've been very roped and binary with it. If we were able to leverage our policy the way it's written in 8450, we could be very nimble.
I'm not exactly sure what your policy says, but to clarify, COVID in the state of Wisconsin is a category 1 communicable disease.
Which is the same as the other diseases you mentioned. So it is treated similarly in our state statutes under public health authority.
Then we should be able to use 8450, Eric. Thank you.
I feel like the struggle with this conversation is that you're talking to a group of medical professionals who have an interest in public health. That's why we're on this committee. But you're also voicing a lot of things that don't at all align with those values, at least for the people on this committee, which is okay if that's the direction you and the school board want to go. But I think it's not really fair to ask us some of these questions because they don't align with the value system of this group that was put together to guide the district through COVID as safely as we could. So I just want to put that out there because I feel like this conversation has been driving in a very specific direction since we got on the call. And if the district wants to be done, then the district can take it to the board and be done if that's what they feel like is right for the community. But I for one won't be giving you a thumbs up from my seat.
No, I understand, Jenny, exactly what you're saying. I think what I would say is I think we're at a crossroads. I think we're at a crossroads of there's a distinct challenge between school operations and the medical challenge that we're facing. And school operations and educating children versus the medical public health piece. I've said it before, you've heard me say this before. Where does the demarcation line change between me as superintendent being a public health official versus being the superintendent start and end? And that's the challenge that the board and I have been receiving from community members, from parents for the last 2-3 weeks. People have said, we need you to be educators, not public health officials. And if you're educators, you need to know that you're failing our kids. And that's a really hard, that's a hard message to hear because we don't want to fail any children.
But can I just ask, because I'm going to make an assumption, perhaps incorrectly. So stop me if I'm wrong. But the people who are the most frustrated I hope it's not people who are having to keep their kids home with COVID. I would hope most people would agree that when your child is COVID positive, your child should stay home from school. So I'm going to assume it's the people who are quarantined, which means it's the 25% of our community that has chosen not to vaccinate themselves or their families. So we have a very loud, what I'm hearing is we have a very loud minority of people who are unhappy when the other 75% of our community is following along with kind of public health guidance. But they're not calling you to say, hey, good job, Dr. Means. We really appreciate that you're keeping our kids safe.
So we're not getting those calls at all. So I'll start there. I would say it's not totally those people in terms of the unvaccinated and quarantined. There are frustrated families who are indicating they're getting close contact letters a week after the contact has occurred. So they're acknowledging that our infrastructure can't handle the surge. I received one email from a parent, which was very touching, from a parent who said, we made a decision as a family not to vaccinate. We feel like we're being segregated. And I received it on the King holiday. And so that parent then weaved in some of the teachings of Dr. King. And again, I'll go back to some of the stress that has been thrust on the system and have taken us away from education and put us more in a public health arena. And it's really made it difficult.
Dr. Means, I think one of the challenges for us is that we can give you medical data, we can give you our best understanding of variants, we can talk through different scenarios and tell you kind of what might be the trade-offs or the pros and cons when it comes to kind of isolations and quarantine numbers. And I hear what you're talking about with the logistics. We're all facing this in our healthcare facilities, right? But we can't control those for you, in terms of those challenges. And so I'll be honest with you, we can't solve those problems, and we can't make the judgment in terms of, what's the right trade-off between that, and between the families, who feel different ways. So I think, I'll be honest, I think we feel like, speak for the group, or at least for myself and maybe what Jenny's saying, but, we can give you data, we can give you our best understanding of Omicron, how it affects children, how it affects adults, those kinds of things. But some of these operational challenges that you're having, I hear what you're saying, but that's not where our expertise is going to be helpful. So if there's, sort of medical issues that we can help with in terms of, again, giving you the different scenarios, the way things could play out if we go one way or another, I think that's where our expertise helps. But I think in terms of what's the right decision for, based on values and operational considerations, that's, to me, that I wish I could help, but I don't know that I can.
No, you guys are a great committee. I think what you're helping me frame is that there are calculated risks if we are going to weight the school operation piece more than the medical public health piece. And it needs to be framed that way. And I think that's very fair. And please know that what you're sharing, everything that you're sharing with me in terms of here's the medical risk of you, and please know when I talk to the families who are posing their counterpoints, everything that you've shared with me tonight, I've shared with them. So I take that position. But I've also promised in a way that I would present their point of view. And there's a role I have to play in making sure that the public hears all of the positions. And so please know that I haven't landed in a final position, but I want to make sure that the dialogue is open, is transparent, and that everyone's hearing all perspectives before we land in a final place. AJ, I see your hand up.
Yeah, I guess that's really ultimately what this all comes down to is what's the risk assessment and what's that balance between operational and medical public health. It's interesting because we had almost this exact same conversation when we convened this committee. That was the crux of it. I think, Tim, you probably remember we talked a lot about that. And I would like to hope that overall we've all kind of evolved as this pandemic has evolved in thinking. I will just say from my own personal standpoint, as being somebody that was probably on the very conservative side of how we were managing this initially, I've evolved as we've gotten more of a greater vaccination rate. I mean, our community overall, compared to many other communities, I mean, I know comparing like Milwaukee to Atosa, our vaccination rates are a lot higher. So I try to think about what's the overall risk for the most vulnerable people, and I think it's getting overall a little bit lower. I don't know if I'm making any sense whatsoever, but I maybe in some respects that balance of risk may be changing a bit. But
I think, Tim, and I think you're right, AJ, too, that with Omicron, it is a different variant. And I think it might be worth talking about that from, you know, again, from a medical and you know, standpoint in terms of what we know about it and what is that risk benefit ratio, because that it does change with different variants. And I want to go back to Tim's point. I think, you know, if we do decide, or, you know, it changes one way or another, I do think it potentially has to be variant specific. I think we, just in the same way that we've had to ebb and flow with this pandemic, I think, as Tim said, if a new variant comes along, God forbid, that is much seriouser, you know, in terms of how it affects children and adults, then we have to potentially pivot. So I don't think it's, you know, unfortunately, I don't know that we're going to ride off into the sunset. And this is going to be, I won't put money that it's going to just be easy and go away from here on out.
Yeah, and so I think we have to be careful obviously we want to keep children safe. I mean, that's our job. It's what I do every day. But in this particular case, especially with Omicron, I guess I would ask, I'd love to hear what people feel about what are we keeping kids specifically safe from, and couch it, and please, in terms of what when you bring up specific risks, put that in terms that we can all understand or relate to, like risk of hospitalization, say with versus RSV, influenza, risk of mortality and morbidity from things that we actually have experience with as humans, having lived on this earth with viruses been around a lot longer. So when somebody says we need to keep our kids safe from COVID, I'd like somebody to define that for me. What is the risk benefit ratio with this particular variant? And I would go so far as to say, what if the board decided not to follow CDC guidelines and say, stay home if you have a fever and you don't feel well, otherwise go to school? What are we keeping them safe from?
I don't necessarily have a quantifiable number for you. I don't think the risk to kids is zero. We know it's less, but it's not zero. So there is always a possibility of long-term effects or hospitalization, but that it obviously is much lower. But that's not the only thing that we're taking into this decision. You know, while kids are, you know, we want to prevent transmission in schools, from a public health standpoint, we are looking at where their transmission, whether it comes from school or a household, goes beyond the school. And schools are a really unique place because they're a big congregating area for kids. There's an opportunity to put mitigation in place, whatever that looks like. That maybe isn't necessarily the same sort of decision-making that happens in other places in our community. So we have an opportunity to help prevent disease spread throughout the community by putting some mitigation in schools. Like we've talked about over the past 2 years, that's hard to quantify and define in many ways, but I don't think just talking about what the risk is to kids for Omicron itself is the only piece to that conversation.
So what I'm hearing then is that we're talking about not so much risk to them, which actually is zero under the age of 10 for mortality in Wisconsin, but risk to others in the community. To which my then question would be, why is it, and maybe this is an issue for our elected representatives on Common Council, then why is it only the school's job? Why is it only our kids' job to protect the rest of the community when there are little to few mitigation measures anywhere else in our community other than government buildings? Again, my issue is with how this disproportionately affects children's, especially mental health and their education, which, you know, is also predictive of health in many ways down the road. I'm having a hard time wondering why the children in our community are bearing this burden disproportionately to everybody else.
I disagree with that. I don't think it's just the kids' job. This is a discussion that happens in workplaces and organizations and hospitals and city buildings all across our city and county and country, across the world. So it's not just kids who are bearing this burden. Contact tracing isn't unique to schools. This happens in businesses. This happens all across the community. Mask is a choice that you can make at a school, just like you can make at a business. They're not bearing the brunt of this alone.
I guess we have to agree to disagree, Laura. I mean,
So I'll jump in on this one because I've had a board member ask the question along the lines of where Tim is, of asking the question where the board member said, if COVID-19 is such a community concern, then there are some communities, even in Wisconsin, who have made mask mandates for their communities again. I think Milwaukee the city of Milwaukee has just made a mask mandate. I think Madison has had a mask mandate for a while. And so I understand there's a fine line. And again, I'm not posing these questions or presenting these concepts in a way to get to a certain point. I'm not. Please. So Jenny, I appreciate your statement, and it's fair. I'm presenting it more as, in my role, I get perspectives from everyone. And so when we have these meetings, I like to tell the community, well, please join our Zoom meeting and you can listen to the entire conversation. You'll hear all the different perspectives, and you'll hear from experts on the risk assessment on both the operational side and also the public health side. And then ultimately, we have to weigh what's really important to us. I think there's a lot of different issues at play. I think the board policy of 8450 is really important. And I think on Monday night when the board discussed this, and thank you, Ann and Laura, I think I would like to point out to them that we should leverage that policy more so we can be more nimble in meeting the family's needs, and being more quick in addressing things. I think that we will always listen to this group and weigh the medical and public health component of it. But I think, if I may be so bold and just candid with you, school administrators have to shift from where we were in March of 2020. In March of 2020, we were frozen. We were frozen and had something we had never seen before, and we're looking for counsel. And now it's almost March of 2022, and there's a balance test that we have to utilize, I think, more. And that balance test has to be, what's the impact on school operations and the school experience for students and their families? And I think it has to be a little more even, and it hasn't been as even. And then there's a component of it where I feel like I have to advocate for staff. The stress and the wear and tear that it has had on our staff has been significant. And I think we're going to start losing people if we don't take into account that we're asking them to maintain an infrastructure that was never meant to try to handle what we're trying to handle right now. And again, I state all of these things not to try to land or to make a point or to defend a position. I'm just stating them as observations.
I mean, I put out there, do you need our group anymore to move forward with your questions and your weighing? I mean, you have your public health department and you have your operational challenges. Is our group still important for your decision making?
I think it is, because I think there are different variants. I think what you shared this evening, there will always be different variants. I think your counsel is always valuable. So yes, I would say yes.
Mm-hmm.
I would say yes.
Because I go back to what Leslie and Jenny shared in that, and you can hear it in our group's recommendations and advice, there's differences even amongst ourselves at this point in terms of the background that we bring to this discussion. And so again, hearing those differences may be helpful, but I do wonder what you're going to take in terms of understanding where you land. But even on the public health side, we certainly recognize that operational challenges are yours and that you need to weigh those, even with public health guidance.
And that's what I'm going to take away from tonight. And we record these meetings. What I'm going to take away from tonight is that in an ideal world, what contact tracing would continue, that quarantining would continue, that the infrastructure that we're trying to maintain, all of those things would continue. But then when you look at the infrastructure and the stress on staffing, there's a different component that we need to keep in mind. That's a second layer. The third layer is the impact on our school community. And that impact on the school community is that, and this is the feedback I've received from that 25%, they feel that they've been disenfranchised and that their voice hasn't been heard at all. And so I want to make sure that all voices are at least, I don't want any stakeholder to feel that I'm not hearing them. And so that's important to me, that's just important. And so I'm taking all of this in. Eric is taking all of this in. I think I saw at least one of our other board members was on the call this evening. Some of our other board members come back and they listen to these sessions. For me, and you asked a really good question. If nothing else, this is a good conversation. That the art of a conversation has been lost in our society, and I appreciate having a conversation with experts that will inform a recommendation in a way that may not align with what you recommend, but it's a well-informed recommendation, and I understand everything and it's weighed appropriately. And that in itself is invaluable to me. In my role, sometimes I don't have the ability to have a civil, intelligent, informed conversation. And these meetings are just that for me. And so for that, I'm deeply grateful.
A question I have, and maybe a suggestion too. I think a lot of the fear and the frustration with our mitigation comes from comparisons with other surrounding districts or neighboring districts. And I wonder if there's a way to actually get data on that. Like it feels a certain way, but I wonder if we actually could get a hold of some data on differences in absenteeism, academic performance. I mean, I wonder if we could actually take a look at that and see where that falls.
We could try. I continue to land on, I think it's comparing apple.
It is.
Yeah, I emailed a community member today. I said it's like comparing apples to watermelons. They're so different. And I think what's happening is that we are being compared to other school districts, and what we're missing in those comparisons, so thank you for your statement. There are advocates in those communities who are saying we want masks, or we want those other protocols on the other side that we don't hear about.
Right. I mean, and again, we can't make everyone happy, but I think this pandemic has been very stressful, to say the least. And I think when people are stressed, they have a tendency toward emotional reasoning. And I would really love to have just anything objective. I think they tried last year. We got a couple of districts in terms of quarantine and that type of rate. So we were able to see that the hybrid mode didn't really make a difference for our younger kids. And that was really helpful. I mean, that's the kind of data that I think we go back to when things just feel really muddy. So if there's any way, acknowledging that it's not going to be great data and it's not going to be super clean, I still think that would be better than, well, they're not wearing masks and that feels a lot better. You know what I mean?
I do.
I know I've shared similar thoughts on previous meetings, but I think there's this idea that, removing masks or removing quarantine is suddenly going to change things. And I think that's a really optimistic view. While we talk about keeping kids in school, but mental health is such a bigger thing than masks. And I think that needs to be also considered. Well, if you're looking at infrastructure or you're looking at your operations, that's one thing, but pushing back on masks from the public perspective, I think there needs to be, clear plans for how we're addressing these things going forward. And that's something we're dealing with at the health department as well, is that this is going to be a very long-term fix. The pandemic has gone on 2 years and recovery from that will probably be much longer. And so it's not just as simple as removing masks in quarantine, it's going to be much bigger than that.
Caitlin, I think it would be appropriate to give you the last word. You have been on the front lines, and I always tell you thank you, and you are such a humble soul, and I know you represent your entire team, but I just want to say it publicly, thank you for everything you've done. I want to give you the last word.
I don't know that I have anything else to add. I think everyone had a lot of great stuff here. And I think everybody wants to do the right thing here, and the right thing just means a lot of different things to a lot of different people. That's about it.
Okay. It is currently 7:32. We have been at it for an hour and a half. I think we've had a good conversation, and we have a healthy audience. I can tell you by my inbox that healthy audience has communicated with our community, and the word has been spread, and people are aware. So I'm glad that people are aware that this discussion is out there and the conversations being discussed in our community. And there will be some recommendation provided to the board at our Monday, January 24th board meeting. Thank you for your counsel, Medical Advisory Committee. Thank you, community, for being engaged. And thank you for being here this evening. With that, we will adjourn. Thank you all.